Welcome back to yet another Eastland County Today live. Today we're going to be talking a little bit about our insurances and such and how that's actually affecting the communities and the job places and such. And without any further ado here, we're going to end up having HV take the wheel.
We have Clint Coffey with us today, local insurance agent, well known, very active in our community, good citizen. And he's going to answer a lot of insurance questions that most of us may know how to ask, but we're not sure what the answers are. Clint, why don't you just give us a quick rundown first, and then we'll jump in when occasion occurs.
All right. Well, kind of one of the topics that we mainly wanted to talk about today, I think, was something that's affected the whole nation, really, and everybody's kind of talking about it, and that's kind of what everybody affectionately calls Obamacare right now. And, kind of what some of the dealings I've had with it, what some experiences with the government website, the coverages, and some of how folks can get subsidies for it and things like that. So kind of, with your permission, I'll just kind of do a little brief overview with it. A lot of folks call it Obamacare. It's actually, a lot of people also know as ACA, or the Affordable Care Act.
Right.
All kind of interchangeable. You'll also hear it often called the healthcare marketplace.
I've heard it called other things.
Yeah, that's true too. That's true too. So kind of all those terms are interchangeable. Affordable Care Act, Obamacare is what everybody calls it. So that's kind of what it goes by now. And so that's kind of what is the law of the land now. When the government first passed it, I think their goal was that each state would set up their own healthcare exchange, or a way for folks to go in and buy health insurance. About half did and about half didn't. And the half that did run their own state exchanges, and the half that didn't all use the federal marketplace. And Texas is one of the states that did not. And so our folks can use the federal marketplace when they enroll if they want. So some of the good things about it, I would say, at least from a customer perspective, is that there is no underwriting now. So somebody comes in and wants health insurance, and it's during an enrollment period.
Well, in your office, do you offer this?
We do.
Okay.
We do. So if somebody wants health insurance, now they really don't have to have any medical questions asked of them. Basically, the only question to ask is whether they use tobacco or not. That's of any medical type question. That does affect their rate, but really it doesn't matter what medical condition a person might have. That's a big difference from the way it used to be.
What about alcohol?
Doesn't ask them any.
Doesn't
ask anything like that at all.
Okay.
So it's different. So from a customer perspective, they can get it if they're during an enrollment period, and I'll mention those a little bit. There's different enrollment periods. So no medical questions. The other is that the government mandated a lot of coverages that have to be in these policies. There's a list of 10 things. I won't go through every one of them, but probably one of the bigger ones is childbirth and child care. Previously, a lot of individual plans, or most of them, didn't cover childbirth, or if you added an endorsement, it was extremely expensive. It's covered now. Child care, very broad coverages for mental health, drug abuse, alcohol abuse, and things like that. 10 things that they kind of mandated, and then a lot of mandated coverages that were like wellness coverage that are outside of the policy deductible that folks can take advantage of. So that's some of the good things about it. Depending on your perspective, some of the bad things about it are the mandated coverages. There's a flip side to everything, and those mandated coverages can certainly, I would think, drive costs up.
What are some of the bad parts?
Now there's big penalties for folks.
That
don't have it.
I see.
That's probably, and I brought a list of the penalties every year, not every year, but for 3 years they multiply and get pretty big. So that's probably one thing. The mandated coverages, I think you could see, this is my opinion, you could see drive the prices up a lot, just because the coverages can be very expensive. Some of the things they mandated, One of them being, no cap in the policy, no 1 million or 2 million or 3 million.
My
So,
word.
so some scary spots of it as well. Well, that's kind of the good and bad. You can only get it during certain times. Open enrollment period. Kind of like how the Medicare system has
Yeah.
worked for years, in that there's a certain time of the year where you can get
Sign
you
up.
can change your Medicare and do things like that. Set up similarly. So, and they've adjusted the dates every year. Maybe they'll have it right where they want it eventually, but right for this coming year, it's going to be from November 1st until I think January 31st. Last year it was November 15th to February 15th, so they kind of backed up the days a little bit this year. They've tweaked those every year, and
As the government is prone to do.
Yes, they have, and they've tweaked them this year 2 or 3 times. In fact,
Does this include prescription drugs?
They all cover. Each plan covers prescription drugs. Some cover it with very little deductible, and some cover it under the larger deductible. So you can kind of pick and choose on different plans whether you want prescription drugs broadly covered or covered under the big deductible, which can be $6,600, is kind of the biggest deductible somebody could have.
May I inject that the one local independent druggist up at Eastland Drug, they will take you, because I've been there, they will take you through a plan, the various plans. They'll examine your plans and compare them and help you find the best. Now, this is kind of off of your subject, I know, but it's important for people to know, I think.
Right. Yeah, they do that, and especially with Medicare Part D plans.
Right.
Because there's a wide variety of those, and they're real good about going through those.
Yeah.
I think.
I apologize for getting you off subject.
That's all right. No problem at all. It was on subject still. Just my opinion on kind of who this has helped the most. Certainly people with pre-existing conditions that could not.
Are they excluded?
They are not. So
they're not excluded.
They're not.
They're going to pay more.
They will pay the same price as somebody that runs a marathon every day. So it is that is certainly the group I think that's helped the most. It's my opinion that for them, they could not get health insurance.
They couldn't get it otherwise.
And they can now. So you could certainly have situations where folks with severe medical conditions could get insurance as long as they were in an enrollment period. If they miss that enrollment period, the government's fairly strict about nobody can enroll outside of an enrollment period. We're in a special enrollment period right now that the government kind of just created this year. Basically, they felt when people were doing their taxes, they were getting surprised that they had to pay a penalty. So they created a kind of a special enrollment period, allegedly for this year only, for folks who have filed their taxes, had to pay a penalty, and will attest to that they didn't really realize all this was going down. And they can enroll up and through the end of April and still inside of an enrollment period if they meet those 3 criteria. So that's kind of an enrollment period that they don't usually have that's going on right now.
Well, what is this penalty? How do they judge what a person owes?
It's a good question. 2014 had its own penalty. 2015 will have its own penalty, and 2016 will have its own penalty.
Escalating, apparently.
Escalating dramatically, especially the last year. I don't have them memorized, so I will take a peek at those.
Now, does that include employers who are required to provide, or who do require if they have 50 employees or something like that?
That's a good question. It does not. If somebody has a qualifying employer plan,
right,
then of course they won't have to pay the penalty. So somebody that has a group plan through work, which a lot of people do, those folks are going to be okay as far as penalty goes. No big issue for them. It's on this As far as the penalty itself goes, some folks have already run into it for 2014.
Well, I was getting
if you
around to
filed
this.
your
What about
taxes
in
this
your
year.
own office? Have you had a number of affected people who have been severely affected by this?
At least in my own office, I haven't, as far as the tax penalty, I haven't had a whole lot of people that come in just too upset. The 2014 penalty is not, because that's what they would be paying this year.
Right.
It's not as onerous as the others are going to be. For 14, and some folks haven't filed their taxes yet, it would be the greater of $95 per adult or $47.50 per child up to age 18, and the maximum of $285 per family, or 1% of their income over the tax filing threshold. Really, it's going to be that 95 or the 47.50. So not a horrible hit. But in 15, for folks filing next year, it jumps to $325 per adult and $162.50 per child, and a max of $975.
Now that could hurt.
It could, it absolutely could. People will feel that. 2016, it really jumped $695 per adult, $347.50 per child, and the max of a family of $2,085.
Right.
So next year it'll be painful. The year after that it'll certainly be painful. So
Has the government had to set up a tremendous another round of administrative, investigative, compliance offices to govern this?
I'm not an expert on that. IRS is really in kind of the one that's involved with the mandate on this. The IRS kind of in charge of this. I know, at least from an enrollment perspective, they've had to hire a lot of people because during that open enrollment period, you could wait an hour or so before you get a person, and they've opened obviously some large.
Does that sound like expanding government?
It definitely was expansion of government, in my opinion. Yeah, I don't see any other way you could slice that. All of the plan providers are individual companies. So a lot of people are under the misconception sometimes that Obamacare is government insurance.
Yeah.
Technically, it's not. They're buying insurance from an individual insurance company. Every state's different. So that part is still coming to an individual company, though. Folks that get subsidized premium, the government pays part of their premium to their insurance company, and then they pay the rest. The subsidies can be extremely large, and the government can pay huge portions of the premium.
Is it based on salary or in total income or
a little bit of both?
Both.
Yeah, both. It's based on household income, and it's based on household members. So a household of 4 has a pretty broad range where they can get subsidized premium versus a household of 2, which is a little narrower and lower. And it's anybody that earns income in that household. So you could have a child that earned income. Sure. It would be included in that. But the ranges on the income are very broad. In fact, I've got them. It's kind of interesting. And I just took this straight off the government's website, which is healthcare.gov.
So if anybody wanted to look that up, they're welcome.
They are. They could. For instance, a household of 4, the income range would be between $23,850 and $95,400.
That's a broad range.
That is a very broad range. The subsidy amount, I don't have it specifically what it would be, but at a household of 4 that made $25,000, it would be several hundred dollars versus one that might make 90.
Right.
It might be $30 a month or something like that. When folks do get subsidized premium, what they'll have to do is guesstimate what their income would be for that year. For right now, people are estimating what their income is for 2015.
Right.
And a lot of times those are estimates. You've got a lot of people that are in and out of jobs, oil field jobs, and things like that. So it's hard to get it exactly right.
It won't be perfect.
It will not be. In fact, you could have a pretty big variance.
Yeah.
what's recommended is that if somebody does either have a big increase or decrease in their income, they would go ahead and update their account with healthcare.gov, and they would adjust that subsidy sum. Because what you might see is you might have somebody who says, I think our household income is going to be $30,000, and they have a fortuitous this year, and they have a $50,000 income. Well, at the end of that year, when they do their taxes, the government's going to say, we based
You
your
made
subsidy.
a little mistake there.
Yeah, that's exactly right. That's exactly right. We based your subsidy on
Yeah.
30. And so what they'll do is they'll calculate, well, we gave you $200 a month. You only needed $100 a month, or so you'll have a tax bill of an extra $1,200 at the end of the year.
What a blow.
Yeah. So that's why guesstimating your income is important.
Yeah.
Very important. So that's kind of how the subsidized premiums work. But on the lower ends of the income scale, you could have folks that had plans that might cost $300 that they might pay $30 for, or $20 for. Very, very heavily subsidized.
Well, do you and your staff spend a lot of time having to explain this to people who come in?
I definitely spent a lot of time
I
during
would
the
think
open
so.
enrollment period.
I would think so.
A lot of time.
It's so complicated.
It is. It's and it's a lot of folks don't like dealing with the website. Don't like dealing
Oh,
with
no. Right.
don't like calling in. They ask you a lot of.
They want to look at Clint Coffee and have him tell you.
That's right. So basically, we help them do it. It doesn't cost them anything on premium to do it. So we've taken a lot of people through that site. It's I do most of mine over the phone. Some people use the website. Last year, which was the first year of Obamacare, the website had horrible problems. You might recall
You couldn't get in.
media.
Yeah, they couldn't get in. Yeah.
Yeah, they seem to have fixed that this year. It's fairly seamless. You might have to wait a while, but it seems fairly seamless now. One of the interesting things, and you may be up on this a little bit, is there's a lot of Supreme Court challenges against Obamacare.
I keep reading, and I keep, the more I see, the more I realize, or I think I understand, the country isn't pleased with it. And whether or not it can be fixed remains to be seen.
Yeah, it's an interesting time right now.
Mhm.
There's one big challenge, Supreme Court challenge. I think I had read that it'll come out in July or so. And it really has to do with the fact that when the bill was originally written, the states that did not create their own exchange were not eligible to get federal subsidies. And so that's what the Supreme Court challenge is about. And so those states, basically the Supreme Court challenge right now is that those states are getting the subsidies incorrectly and they should stop. So you could, if that happens, you could foresee a situation where I don't know what they would do. I have no idea, but where the subsidies stop for millions of people.
But don't we understand that about half the states went in and about half stayed out? Is that about?
Almost exactly right. Yeah, very close. So you could have a situation where half the states and millions of people all of a sudden stop receiving subsidies. And I doubt, in my opinion, the majority would not keep their health insurance.
Well, do I remember that the plan was finally approved by the Supreme Court by one vote?
Yeah, that's right.
That's my memory.
That's right. Yeah, the last challenge to it was by one vote, and I don't remember what that challenge was about. It was on kind of whether or not this was actually a tax or not.
Yes, that's what it was.
And you're right. John Roberts, I think, was the one who was a swing vote. And everybody was surprised a little bit.
Yeah.
This one's a completely different challenge. It's kind of based on some wording in the law directly related to subsidies. And it'd be interesting if it does happen and if they do find them illegal, then what will happen in the marketplace, or what will happen in the health insurance world in those states will be scary and fascinating.
Absolutely.
So that's something I've been kind of watching closely just to see what happens on it.
Who can say what the Supreme Court will do?
Yeah, no, that's exactly right.
Based on history.
Yeah, it will be very interesting to see what they do. Very interesting.
I've interrupted you enough. You go ahead and give us what you'd like
That's
for
okay.
the public to know.
That's okay.
This might hopefully will save you some explanations because you have been so good at making things clear.
Okay.
Hopefully, and you're talking to a lot of people this morning. So,
Well, it's just a few other things that I'll mention, and you can ask any questions that you would like. Some of the things that they intended to do with this Obamacare type coverage was they hoped it would save money because folks would actually be getting some preventative care that they would never have gotten otherwise. And so one of the downfalls you hear folks say about these plans, they have high deductibles. And I'll back up just a little bit. Most all the companies name their plans after metallic names: bronze, silver, gold, platinum.
okay. Yeah.
Okay. And so bronze wasn't as good as the silver. Silver's not as good as gold. On up. The government really hoped that people would take silver plans, at least a silver
Middle
plan.
ground.
Yeah. Not the bronze, though that is an option. But they really want people to take silver. And to entice them to do that, especially folks that receive subsidies, not only might their plan be subsidized, but their deductible could be extremely lowered. So somebody might, if they're subsidized, they might come in and purchase a bronze plan and they have a $6,600 per person deductible. They might have the option of a silver plan that was a little bit more, however much more it might be. Sometimes not a whole lot, but instead of a $6,600 deductible, it might be a $500 deductible, or it might be a $750 deductible, dramatically less. And the government's goal was to entice people into silver plans, and then their plan was effective, in my opinion, because a lot of times the difference in premium is very small, and the difference in coverage is big. So that's one of the other little interesting quirks in the plan. So you see that a lot. But as far as preventative care goes, that's one of their big pushes. So lots of screenings are covered, whether without any deductible. Aortic aneurysm screening, alcohol abuse screening, blood pressure, a well checkup every year, HIV, diet counseling, diabetes, depression
You
screening.
mean they automatically pay for these?
Absolutely right. Free preventative services. So that's outside of their deductible. And I think the government's goal in that was hopefully over the long run they save money on folks who actually get things caught early, and that may well be true. But there's a lot of free preventative services that are required and mandated in these plans. So that's kind of one of the things that most folks would consider.
Well, that's a plus. Anything you can prevent is good for everybody.
Right. The other things that are kind of mandated in the plans, and again, this is straight off the government's website, but outpatient care, ER trips, inpatient hospital care before and after a baby's born. That's a big one. Mental health, substance abuse, prescription drugs, lab tests, counseling, just pediatrics. A lot of pediatric services. There's a little bit of dental coverage that's the government has mandated it for pediatrics, for kids. Not so for adults necessarily, but a lot of plans allow that to be added. So that's kind of what it covers and what it's mandated. Now the employer plans that folks are on, they have to put a lot of this into place as well. So you'll see some changes in their coverages. Some are grandfathered. A lot of the requirements for employer plans, the government, the president pushed those requirements off after this last election, so they won't come in. You won't see them for a few months down the road.
I see.
For whatever reason that might have been. But you'll see some changes in some of the group plans as well. That's kind of Obamacare in a nutshell.
How does a graceful way to say a woman's right for birthing. Where does it fit in here?
And honestly, I can't answer that question for you very well. We'll answer that.
I don't.
I know there's broad coverage for all kinds of childbirth, and I
Yeah.
know there's broad coverage for prescription drugs. There are some drugs I'm sure that there are on the formularies, but I know there's pretty broad prescription drug coverage. So I don't know the answer to that question. I don't.
Okay. Clint, I guess we can sign off unless you have something you especially would like to share with us, and jointly hope that there's not a hailstorm this year.
Boy, that's right. We had a big one.
What was it,
October
06?
Well,
October
13,
last year.
yeah.
That's right.
Yeah, we don't want another one of those.
No.
Yeah, that's no fun. About the only thing I'd say is, I would recommend that folks be cautious of a couple things. One, the enrollment periods, and the one thing I'll add,
we should post those. Would you help us post those?
I can get you a copy.
That
of
way
those.
we'll let people know.
And folks need to also know that throughout the year, if they have life events that occur, those can create an enrollment period just for that person. So if somebody got laid off and they lost their group plan,
Right.
that creates an enrollment period for them. So they could come and enroll in a plan anytime during the year if they run into a special enrollment period. So for instance, some of those would be, and these are important, and they happen a lot. Somebody gets married, that creates a special enrollment
difference.
period.
Yeah.
Having a baby creates a special enrollment period. Adopting a child, losing other health coverage. So, if somebody loses their job or they have a plan that ends or they lose their health coverage, it can create a special enrollment period for them.
Or a death in the family?
If it was a death in the family, if it was to somebody that was the primary group plan holder, yes, it could. Moving outside of your plan's coverage area. A lot of people are moving around right now with job things that are going on. And some of these plans are real state specific because they were created in state plans. So a plan might not cover outside of a state, outside of Texas. So if somebody moves outside a plan area.
Are our neighbor states in or out?
All of our neighbor states that I know of are out. I'm not sure about New Mexico, but the other ones are that gaining citizenship opens an enrollment period. Leaving jail opens an enrollment period.
Getting in jail?
No, that is not one. Change in income or a household status that affects the eligibility for premium taxes. And really what that means is if folks have a big income change, they need to and they have a plan already, they need to make sure and let the marketplace know, because they do not want folks getting hit with a giant tax scare. So I'd end on that. Probably folks need to make sure they're guesstimating as closely as they can. They don't want to have a really big tax bill. They also need to make sure the tax penalties get large. So they're almost by the end of next year, they're going to be forced into doing something because it's a big tax bill.
What about immigrants?
I'm not an expert on that area. However, if somebody has immigrated here and become a U.S. citizen, they have become a U.S. citizen. They're eligible. There's also some. There's also some availability for folks. It's my understanding for folks who are permanent residents, have received a permanent residency.
Permits, yeah.
They are also able to purchase a plan.
Well, Clint, you could talk insurance all day because I know you're a professional, but I've run out of questions.
Well, I appreciate you letting me talk about it. I enjoyed it. I certainly don't know everything on it, but I've learned a lot in the last few months.
Well, you shared a lot, and I appreciate your coming and sharing it with us and with the public, because that's our job, is to try to help people understand what's going on.
Well, I'm glad to do it.
Thank you so much.
Thanks.
And that's been yet another Eastland County Today Live. You guys tune in later. We'll end up having some more. We'll catch you guys next time.